Welcome to Baby Brunch. If you are trying to conceive, understanding fertility will help you achieve your goals so much faster. And that's exactly what we're talking about today. Doctor, thank you so much for joining us. We're going to get straight into it. Fertility has so many question marks around it this term. What exactly does fertility mean?
I think that fertility obviously can mean different things, but in the context of my work, it means the ability for a woman or a couple to conceive and obviously ultimately have a child. Now, infertility we would define as the inability of a couple to have a pregnancy after 1 year of having unprotected intercourse. Obviously, we don't use the term sterility anymore, so we would use fertility as the ability to conceive, and infertility, obviously, the inability to conceive after 1 year.
Is there a test that one takes to see if you're fertile or not?
I think that a lot of people talk about fertility tests, and there's no specific test that one can do. Obviously, there's a workup that we do when people don't conceive. So obviously, we do hormonal tests where we can see whether the person is ovulating, so we can confirm ovulation. We can also do blood tests to actually confirm what we refer to as ovarian reserve, meaning the number of eggs that are in the ovary. Then further tests, which is more invasive, would obviously involve ultrasound to look at the womb to see whether there's any problems inside the womb, as well as specific tests to check whether the tubes are patent. So that is normally done, when people don't conceive, as part of the workup. But, there's no single test that actually can confirm that the woman is fertile.
I mean, I've heard of diets, and I have heard of medicines and special exercises. What can one do to boost fertility?
Well, once again, I think that there are myths and there's facts. What we know about diet, one can firstly equate to female weight, meaning if a woman are either too thin, meaning the BMI is too low, or obese, that can directly impact on the chance to conceive. If we talk about specific diets, obviously, then we look at things which has been proven is to have diets which is obviously healthy and balanced, which doesn't contain a lot of processed food. There are specific things which are said to be beneficial, like, for instance, avos or some nuts, but also, to avoid, as I said, fatty foods, processed foods, and also look at your weight to be in the general normal range. From a scientific point of view, the so-called fertility diets doesn't have a lot of proof to be beneficial. So the short answer is to have a balanced and healthy diet and to look at your weight.
I immediately start thinking, well, how long do we try for a baby before we go and seek for advice, before we think that there might be something that is worrying?
So what do we know? We know that the best chance to conceive is actually in the first months after they start to try. And that's because the people with the best chance will conceive first. So we normally would advise couples, to at least try for 1 year before they would then seek help. We would advise people that are older, meaning older than 35, to maybe seek help earlier at around 35, and women over 40, meaning even to consult with a doctor, even before they start, so because time is running out in the older group of patients. So the short answer is after 1 year, but in specific cases, one need to seek help earlier.
So in order to see an expert, who do we see and where do we start?
I think that, in my opinion, the management of infertility is obviously not only does not only involve the fertility specialist or the reproductive medicine specialist. We obviously at the end of the line, but sometimes you can start with your clinic, or you can start with your general practitioner in the beginning, and they can start doing certain tests, check ovulation, check the sperm count. The general gynecologist is also very important in terms of the general management and also the workup of patients. But obviously, if one don't fall pregnant after a specific time, it is advised to consult with a fertility clinic.
Thank you very much for your time. Well, for other videos, you're welcome to check out babybrunch.co.za.